Well, good morning, everybody. It's a great pleasure for me to be here with you today, and I would like to thank Dr. Sa for inviting me from Italy to come to share some of the knowledge about periodontology in this day that we'll spend together. The topic of my first presentation is the role of the periodontist in creating a beautiful smile. If we look at periodontal therapy in the new millennium, we will see that basically we do the same things that we were doing years ago. So we do infection control, we do pocket reduction, we do regenerative therapy. The big change in the way we approach our periodontal cases is actually that there is a large request from the patients to do aesthetic therapy. So patients are not anymore just happy to save their teeth, but they want to have the gums in the right position, they want to have the papillas, they want to have all kinds of things in place. So the way the periodontist is approaching the therapy nowadays is slightly different from the one that we used to do 10, 15 years ago. Let's look at this first case. Basically, we can see this not very old lady that unfortunately, she went through a rough time. She lost her husband because of cancer. And the fact that her immunitary system basically lowered the defenses brought her to have aggressive periodontal disease. But you can see that from the baseline, what you see on the left side of the screen, to the right side has only been about 7, 8 months. What made this big difference? The big difference was the dentistry that was done to her. She had lost all the upper teeth, and basically she was wearing a full denture. And what we did was very simple. So replace the missing teeth with a nicely done and well-designed full denture and a full arch on implants in the lower arch. So you can see that from the left to the right, she completely changed her look. She looks younger. The vertical dimension is restored. She got a nice tan, and she even got a new boyfriend. So it's really a big change in her life. This is also a very close friend of mine, family friend, that showed up in the clinic with 2 full dentures and said, I've been dreaming for years to have fixed teeth. So basically we did a study of the case with modern technology. So we did guided implants in the upper and in the lower arch. We gave him fixed teeth, and you can see the way his face is changing from the face side and from the side. The different position from the nose to the chin, the full mouth of teeth changes completely the face, the look, and makes the patient look happier and younger. This is another patient that we have treated. You can see on the left side of the screen the way she showed up with a poor occlusion, poorly designed crowns, and she had to go through some of the steps that we will see today in the presentation: wax up, mock up, prosthetic preparation of the teeth, and other things to look completely different when she's going through dental treatment. So we really enjoy showing this, changing the look and changing the attitude of this patient. This is another periodontally involved patient before and after, and this again is another patient before and after therapy. Change the look, change the glasses, and a new attitude, a new way to go. This is another young lady that showed up in the clinic. As you can see, she lost some vertical dimension also because of periodontal disease. The teeth are flaring. So we did something very simple. Initial therapy, some temporaries, trying to restore the vertical dimension. And you can see that only 3, 4 months later, she looks completely different. She looks much younger than what she looked at the baseline. So what we can say that all the things that we have seen in these previous slides are done with prosthetic dentistry. So prosthetic dentistry and cosmetic dentistry do miracles. One of these miracles is the use of laminates. Restorative dentists, prosthodontists, and the demand of the patient for laminates is really, really high. If you are on the social networks, you will see that all kinds of laminates are thrown into the market, from the additional to the conventional to the new technologies, thin, extra thin, sometimes invisible. But obviously, that's the way we go, and we do preparation of the teeth. We do actually, we can mix and match. Sometimes some are bonded, some are, cemented, and we can really change the smile of a person. We can change the color, we can change the shape of the teeth, and get fantastic results. This is actually what we do in one of my practices with my partner, Dr. Alessandro Conti. He's a very young guy, but very talented, and we also work with the technician, that is Davide Bertazzo, who's also a very uprising star in the Italian dental technology. So we can see that a lady that shows up with a smile that is a little bit unconventional. She has different colors, she has different shapes of the teeth, and she wants to look better, is put through therapy, and really we can put her in a new position with a new smile, with a nice integration between the pink and the white of the teeth, and now she can smile happily in a different way. Always, and we will see it in the afternoon when we'll talk about biomimetic periodontology, whatever is natural is always beautiful. This is a way to show that the nature is beautiful in all the 4 seasons. There is no seasons that is ugly. I mean, the winter, the spring, the summer, and the fall, they're all in a way beautiful. So actually everything that we look for is for natural beauty always. And of course, the periodontist also has a role in creating this kind of beauty. Actually, not really creating, but sometimes exposing something that is actually hidden by a condition that is called altered passive eruption. Many, many times I get patients referred by other dentists, and they think the patients need to have root coverage, or they need